Decreasing the amount of people with alcohol addiction and reducing the proportion of people who had alcohol use disorder in the past, by Courtney Thomas for Nursing 102 on April 8th, 2021. Topic: Alcohol addiction. The goal is to decrease the amount of people with alcohol addiction, and the objective is to reduce the proportion of people who had alcohol use disorder in the past year. What is alcohol addiction and alcoholism? Alcohol addiction is a chronic disease characterized by uncontrolled drinking and preoccupation with alcohol. Alcoholism is the inability to control drinking due to both a physical and emotional dependence on alcohol. Statistics. The incident rate. According to the CDC, more than half of the U.S. adult population drank alcohol in the past 30 days. About 16% of the adults reported binge drinking and 7% reported heavy drinking. Prevalence rate. It is very hard to determine how many people in the United States suffer from alcohol use disorder because most people do not speak up about having it, but the percent of people 18 or older who had at least one heavy drinking day in the past year was 25.1%. According to a new study published in the Journal of the American Medical Association, 1 in every 8 Americans is struggling with an alcohol use disorder. This staggering statistic means that almost 30 million people in the U.S. are unable to control their alcohol intake, a remarkable 50% increase from 2003. Those 65 years or older saw the largest increase in people struggling with an alcohol use disorder. Causes of alcohol addiction or alcoholism is genetics, psychological, social, and environmental factors. Over time, drinking too much may change the normal function in certain areas of your brain, and this results in craving more alcohol to try to restore good feelings and to reduce the negative ones. Risk factors. The modifiable risk factors are steady drinking over time, starting at an early age, and social and cultural factors. The unmodifiable risk factors are your family history, history of trauma, having bariatric surgery, depression, and other mental problems. Symptoms of alcohol use disorder is memory loss, mood swings, breathing difficulties, hepatitis, irregular heart rate, strokes, high blood pressure, and these are just to name a few. Recommendations for improvement are that people must be aware about all the modifiable risk factors of alcohol addiction and that they are in charge if they become addicted or not. There also needs to be an easier way to be able to say that you are addicted to alcohol and not to be embarrassed by it. We also need to make AA meetings a more common thing and that there will not zone out or seen as someone different because that makes them not want to come out and tell people and possibly get help. Resources. Local resources is Journey Pure. They have a resource here in Bowling Green that they use, and they use experimental therapies, group therapies, and they also help with life planning for after you leave. They also promise that after 6 months you will leave sober and you will stay that way. For state resources at Sunshine Behavioral Health, there are also many free resources in the state of Kentucky, such as AA meetings, 12-step programs, and sober living homes. You can even talk with a treatment specialist. For national resources, SAMHSA's National Helpline is the best way to go. It is confidential, free, 24 hours a day, 365 days a year information service in English and in Spanish for individuals and family members facing mental and/or substance abuse disorders. This service provides referrals to local treatment facilities, support groups, and community-based organizations. Callers can also order free publications and other information. These were my references that I used throughout the presentation, and these were the ones that I used for the pictures.